Tuning in. This is Medi and my name is Mombi Mavuti. Thank you so much and karibu sana Medi. Yeah, how are you?
I'm good. Thank you for having me. I'm a nurse working in Karatina Sub-County Hospital, and today we'll be discussing gastritis and stomach ulcers. Yeah.
Asante sana. So let's just begin right there. What is gastritis?
In a layman's perspective, gastritis is the swelling of the abdominal lining, and in medical term we call it inflammation of the inflammation of swelling of the lining of the stomach. Yes, and the stomach has like 3 layers. There is the mucosal layer, there is submucosal layer, and there's the muscularis. So the lining happens in the inside the stomach, the mucosa lining.
So by the time we are saying someone maybe has gastritis, it's the first layer that is affected.
The inner one. The inner one. Yes.
The most inner one.
Yeah.
Nice. And we have also had terms that are closely associated with gastritis, like stomach ulcers. Is there a difference?
Yeah, there is a difference between an ulcer. Okay. There's no much difference because sometimes the stomach ulcers present as gastritis. Only that for the ulcers, the gastritis is the inflammation of the mucosal lining, and for the stomach ulcers, it's the lesion. It causes sores inside the stomach, the innermost lining of the stomach. Yeah.
So by the time we're saying someone has ulcers, maybe it's gastritis that has worsened, or ulcers is or gastritis is stomach ulcers that has worsened, which is severe.
Gastritis, if it is left untreated, there's acute and chronic. So if it is left untreated, you'll find that there'll be lesions that will occur in the mucosal lining. Yeah.
Thank you so much. And do we have types of gastritis, or are they all the same? Like I mentioned, to do with acute, like that's one. Do we have other types of gastritis?
Yeah, we have four types of gastritis. There's acute gastritis. That means there is a sudden onset, which can last between 2 days to 10 days. Yes, and it's treated. Sometimes it goes by itself, and it is also treatable with antacids and pain medication. And then there is chronic, which is, if you don't treat the acute, it comes there, it goes to chronic if left untreated, and it can last for months or even longer years. Yes,
if it's left untreated.
Yes.
And then we've also heard about erosive and non-erosive gastritis.
Yeah.
Which are those?
For erosive, as the word suggests, there is erosion. It's like wearing off, scraping off of the lining of the stomach. So you'll find this mostly, it happens when the gastritis has severe to ulcers. And so now there will be wearing off of the innermost lining. Yeah. And non-erosive, it doesn't leave like sores of erosions in the stomach. So it just inflames, swells, and reddens.
Thank you so much for that basis. But now we know that it's quite a common kind of a disease or condition amongst our people. Like it's something you will hear every other day, that I have gastritis, I have stomach ulcers. What is causing it?
We have different things that cause the gastritis and ulcer and stomach ulcers. So we have long overuse of pain medication, like they are called NSAIDs. For example, NSAIDs like diclofenac, probably overuse of the medication, alcohol use, hard liquor, and there is also a bacteria that is called H. pylori that contributes a bigger part with the stomach gastritis and ulcers. Yeah.
And what is going to cause this bacteria? Is it Is it something from the external or from the things that we are eating, the things that we are consuming, or what is causing H. pylori, and who is at risk? Who is at risk of maybe being infected with this bacteria?
Okay. For the bacteria, the H. pylori bacteria, it is transmitted from person to person. For example, if you have the bacteria and we share certain utensils, or if my partner has the bacteria, if you happen to indulge in like kissing, you'll find like I can obtain the bacteria, and also it's a fecal oral route. Because if you don't wash your hands well, you know how our hands are the most delicate. Yeah, so if you don't wash them, you can infect yourself. It's fecal oral route, and also, things, fluid body to body. If you exchange fluids and you have the bacteria, it might affect me as well. Yeah,
and that means we should maintain high levels of hygiene if we are to keep it at bay.
Yes, so, and then sorry, you ask about the risk age of the people. If you by age, like elderly people, are at a higher risk of getting the bacteria, and also the socio-economic factor, it affects also. Because if you're living in a crowded place, there's no water, clean water, sanitization, all those that can lead to the bacteria. Yes, ingestion of the bacteria.
Thank you so much. So you happen to mention about other causes such as alcohol intake and overuse of certain drugs that you mentioned. For people with cancer, does chemo and radiotherapy increase their chances of having gastritis in any way?
Yes, because some medication used in chemotherapy, it leads to the erosion of the lining, because everything that is happening with gastritis and peptic ulcer, it's the lining. We're talking about the lining of the stomach. So you'll find that not be able to eat enough food. So when the stomach is empty, we have HCl in the stomach. So the erosion of the stomach, it will make you like kweroroka. Yes, that's normally how they call it, kweroroka. Now you'll find that the production of bile is in excess because there is nothing in the stomach at the moment. So you tend to bulge and to get a reflux.
And are there chances that gastritis will just happen due to autoimmune factors? Like there isn't we don't have a necessary cause for it, or something to point out that it was caused by this and that?
If it causes by autoimmune, it means like in most cases a patient has an autoimmune disease already, like where the autoimmune is where the immune system affects our cells, the normal cells. So you'll find in autoimmune, the epithelial cells is the cells in the stomach. They get affected. They are healthy cells in the stomach. They get affected. Yes. So autoimmune plays a part also. Yeah.
Thank you so much for that. Now we know what would cause or what would bring about gastritis. But then someone is wondering, what will I feel? What are the warning signs? What are the signs and symptoms of gastritis?
For gastritis, you'll tend to have nausea. Nausea is feeling like you want to vomit, and now vomiting will follow. And if you're having nausea, you'll have loss of appetite. You'll not be able to feed well, and you have bloating, pain, especially around the chest, between the chest and the upper abdomen. You'll feel the burning sensation when you're having gastritis. It's called kiunguria in Kiswahili. Kikuyu, it's close to that.
Is it the same as heartburn?
Yeah, people call it heartburn, but it's the burning sensation. Yes.
And is there anything else somebody is going to feel like in their body? And how do you tell that this is a normal, for lack of a better word, a normal stomach ache that will go away, and this is gastritis pain?
In that situation, this normal stomach ache, you will not present with the burning sensation. You'll just have a discomfort in your abdomen, which goes away within a day or hours if you take an antacid or a pain medication. For gastritis, it will present with the symptoms that you talked about. Yeah.
And as someone with gastritis, maybe they have not even realized that they have gastritis. Is their appetite normal?
No. When you have gastritis, your appetite will be lower than the normal because you're experiencing nausea. So you tend to eat less. And if you eat less, you shed weight. So if you get these alarming signs like continually, that's when you go to visit a doctor, because sometimes we get stomach upset, gastritis, and we think it's stomach upset, and we don't go to see the doctor. If the symptoms persist, you go to the hospital. Yeah.
And by the time someone is vomiting and the vomit, you said that one of the signs is that someone could actually vomit, and then they are vomiting and there are blood traces in the vomit, or maybe blood in stool. Does that mean that it is at an advanced stage?
No, it means the gastritis has gotten to chronic, because now it has, if you see blood stains in your vomit or probably in your stool, it means there's some bleeding inside your stomach, the lining of your stomach, and or in the esophagus, because the stomach ulcers are into three. They have three parts. It can affect the esophagus, that is esophageal ulcer, and then now the stomach ulcer or duodenal ulcer, just a small portion of your intestines, the small intestines. Yeah.
And if gastritis is, we're going to talk about treatment, but just in case that someone sits at home with gastritis and maybe they're just buying over-the-counter drugs or something like that, is it possible that it could lead to a more complicated scenario? Are there complications that result from gastritis?
If you're not treated, for example, we said the major factor for gastritis and stomach ulcers is H. pylori. It's nice to visit the doctor or the laboratory near you for you to get the bacteria tested or to get the blood tested for you to know the advancement of the disease, because you might use the medication and it will not go away. It will last for years and years because you haven't treated the root cause of the condition, and now it will worsen the disease. Yeah.
So it can lead to something like gastrointestinal bleeding, and how complicated is that?
The moment you haven't treated the acute gastritis, it will go to chronic, and now the chronic, you will have the erosion. So you'll have the sores inside your stomach, which might advance and cause the bleeding. And also in the worst cases, you'll find a disease called peritonitis, where the stomach lining perforates, and now the contents of the stomach goes inside your abdomen, and in those cases it needs surgery. Yeah.
Which is quite complicated, given that it's something that can be easily arrested if noticed in time. So while we're still talking about gastritis, before we get to treatment, and you give us treatment options and what it entails, how do you diagnose it?
diagnosis of the, if you do a physical examination, like normally it's good to do a physical examination to know the extent of the condition, where it is, because if you observe the abdomen, like a normal abdomen, it sits. If it's acute gastritis, even chronic, you will hardly see the inflammation of the abdomen, because you need to visualize the inside. So if you're having gastritis, you need to do an endoscopic procedure, where endoscopic is you use a camera through your mouth, and it goes to visualize your abdomen, esophagus, and the part of the duodenum. Yeah.
That's the only way that
no we have several we can do. For you to know, I've mentioned endoscopy, and you have a barium contrast X-ray, where you ingest, it is a liquid you ingest for a proper visualization of the X-ray. So for you to see whether there are lesions, the doctor to see whether there are lesions along the duodenal canal.
You talked about insertion of a camera to see whether someone has ulcers or gastritis.
Yeah.
Is that going to be painful?
No. It's just a discomfort, because it's not the normal thing that is going inside your body. But in most cases, they give you a sedative for you, and a pain medication, so you'll not feel the pain. It's just a little discomfort that will help the procedure to go on. Yes.
For now, you're not scared. We know it's only going to be uncomfortable and not painful. So if you feel like you have any of the signs that we've talked about, go visit a clinic near you. Don't shy away. So let's talk about treatment. How do we treat gastritis? And is it curable, or is it that when someone has gastritis, it's something they have to deal with and manage as long as they live?
Gastritis is treatable, it's curable, and in a case of acute gastritis, it goes away within 2 to 10 days. Acute gastritis is not, it goes away by itself, and also you can use an antacid. And now if it has advanced to chronic, now, or you have gone to the hospital, the lab says you have an active H. pylori bacteria in your body, you'll treat the bacteria, where you involve a treatment of 2 antibiotics and in another medication called protein pump inhibitors. As people know at home, we call it esomeprazole, omeprazole. Ile kadawa iko na ndani. Yes, you take that, and you avoid, when it comes to treatment of the gastritis, you avoid the NSAIDs medication like diclofenac, because they play a big part in the worsening the condition. Yeah.
So before we wrap up on treatment, are you facing a challenge as medical professionals with self-treatment? People going to treat themselves, given that you're mentioning that when someone is taking certain medications for gastritis, they cannot take other types of medications, or there are certain medications that someone with gastritis should avoid, but people are so willing to go buy drugs over the counter. Is that a challenge that you're facing as health professionals?
Yes. It's actually the disease or the problem that is causing the stomach upset, because gastritis is the medical term we give to the patients. For them, they will come with a heartburn. They don't know whether it's ulcers or gastritis, or it can be an advanced problem or another disease affecting your gastrointestinal system. So you're going to take this medication, and it is not going to cure the other condition. So if you have the symptoms and they haven't gone away within a day or two, it's good to visit a doctor for you to be treated for the exact same disease. Yeah.
Thank you so much. We're going to be hammering more on that, but first, let's take a quick break. Thank you so much for staying tuned in. See you in a few.
We are putting certainty in their future so you can have a peaceful life. Exploring emerging opportunities so you can explore life. Covering your health so you can share your well-being with others. Taking care of your investments so you can enjoy the fruits of your wise decisions. With Britam, we are assured of over 55 years experience in life insurance, health insurance, general insurance, investments, and retirement solutions. Britam, with you every step of the way.
The Nyeri National Polytechnic nĩ mũrakũnyita ũgenie thĩinĩ wa TVET at the Hadley Torch and Flame Lounge nĩ mũthenya wa kerĩ tarĩki 26 mweri tũrĩ wa gatatũ kwambĩrĩria thaa 3 cia rũcinĩ. Maya mothe magatabania thĩinĩ wa The Nyeri National Polytechnic Grounds. Mũgeni wa gĩtĩo nĩ His Excellency Dr. William Ruto. Igongona rĩrĩ rĩkamemerekio ĩmwe kwa ĩmwe nĩ GTN TV. Ndũkanatĩre.
Sharia hado ũngĩthomera gũkunya gita, piano kana mĩgambo nĩyo vocals. Rehoboth School of Music maheanaga mathomo ma kĩrathi kĩa igũrũ mũno. Macerere Nyeri Town harĩa opposite Naivas Supermarket, kana waranĩrie nao kũhetũkĩra namba cia thimũ 0715 031 506. Rehoboth School of Music, cama wa rwĩmbo nĩ inanda.
Kwĩwatĩra Musa kũrĩra kwa Jethero Ro Andy Wawa featuring Elizabeth Nyambere. Taskiza tuni ya thimũ yaku hihinya *837 *3260# ũkenagie harĩa marakũrĩra thimũ na rũgambi rũrũ.
Welcome back, and thank you so much for keeping it GTN TV, the home of gifts and talents. This is Medi, and today we are talking about gastritis, and we are quite learning a lot. We've talked about what it is, what are the signs and the symptoms, what are the causes, and now we are just about talking. About treatment, and we've been told that I should not treat yourself because you are worsening. So when you're talking about treatment and how to get better when you have gastritis, are there things that mostly foods, because you're talking about the stomach, are there foods that these people should not take in, and what are the best foods for them?
Right. We talked about gastritis as the inflammation or irritation of the lining of the stomach, and we say the symptoms, the causes are like drugs, smoking, alcohol, and a certain medication. So don'ts for gastritis, for people with gastritis, suffering from gastritis, is do not smoke, do not take alcohol, reduce the intake of the medication, the pain medication, because normally people use medication a lot. Naumwa na kichwa, and then they run to over the counter to get a certain medication, not knowing you're worsening or you're risking giving a risk to the stomach lining. And even more for don'ts, the reason why we discourage taking over-the-counter drugs, it's because you might be having a different condition, or if you're a woman, you might be pregnant and you're confusing gastritis for pregnancy, early stages of pregnancy. So you limit on the over-the-counter medication. Yeah.
Thank you so much for that. Are there certain foods that these people should avoid?
Yes. We have like spicy foods, foods that cause you allergy. We know them. If we say for spicy food is too much excess, is the spices that we normally use for like pilau, it has excess spices. We do pili-pili in bigger quantities. It tends to worsen the condition. For it is irritating if the food has acidity or the spices, they counter with the HCl that is produced in the body, thus worsening the condition. Yeah.
And also talking about that, I hear people, I don't know, even friends, that kama uko na ulcers, someone tells you, usijipe stress, utaanza kuumwa na ulcers. Is there a correlation from a professional point of view, from a medical professional? Can stress accelerate gastritis or cause more pain, or maybe, I don't know, is it possible?
Yeah, I also heard people saying, hey, stress, but psychological stress, if it happens, if it affects your day-to-day life, for like, we have different stresses. We have physiological and psychological stress. So if you have psychological, which is mental, it is affecting your day-to-day living. So you might find yourself, you're not eating enough. Your appetite has gone low. So if the stomach has nothing, the production of HCl will still be produced, thus infecting your stomach. So stress, stress alone doesn't lead, but physiological, there's physical and psychological. Physiological stress, it means like there is trauma, like injury. Trauma is injury, which will cause to the stomach to be affected in one way or another. But psychological stress, it doesn't contribute unless it is affecting your day-to-day life, like eating and yes, and such things.
My producer, Mr. Muredi, is following so closely on this show, and he's telling me when you talk about ulcers, he's getting it like tumbo iko na vidonda. Now he's asking, nikikunywa maji moto, is it going to affect?
No, for ulcers, no, it will not. Water is pure. Water is, we live for water, but it doesn't affect. Only that if the ulcers have started from the esophagus, it will get the irritation, some irritation on the stomach, but it will not affect the they worsen the situation. And then we go to spicy food. Don't take the spicy food.
Before we go there, what are the chances that everyone who is consuming alcohol could get gastritis in future?
The chances, the rate is very high, because if the moment you ingest, the moment you ingest the alcohol, it irritates the mucus, the mucosal lining. And everything that involves with the gastritis and ulcers, it is because the lining of the stomach, ndani ya stomach, inakuliwa. It is eaten up, wearing off. So the hard liquors like, for example, whiskey, gin and vodka, it irritates the lining of the stomach, and so now it causes the hyper, what is the best word to use? Like more production of the HCl.
The esophagus.
In that cases, if the gastritis is not treatable, it moves to the chronic gastritis, and now there will be excessive production of the HCl. So when you're vomiting, because we said one of the symptoms is vomiting and nausea. When you're vomiting, the HCl goes up to the esophagus. It is the gastrointestinal. It moves from the mouth, the esophagus, the stomach, the duodenum, all the way to the rectum. So if you vomit the HCl, it irritates the lining. The moment you forcing something out, it causes inflammation, and inflammation goes, and inflammation is swelling. Inflammation goes, the more you're getting irritated. Yes.
Thank you so much for that. So we're still talking about how to prevent it, and you've said that someone is taking alcohol, they should stop or minimize. I'm sure there are many other ways of preventing gastritis. Going back to our causes, because when you mentioned that H. pylori is one major cause.
Yeah.
So what do you advise the communities and I don't know, the government, because you talked about congestion. So what's your call? How do we arrest this before it becomes a disaster?
We said one thing is to treat. If you have a stomach condition or you have presented with the above symptoms that we talked, like belching, too much gas in your stomach, you go to the hospital and get tested for you to treat the root cause. So how to prevent it is treatment. The first thing is treatment, and because if you treat, you'll know whether your partner or if you find yourself with the bacteria, you will advise the other person to get treated. So now it will be like you continually treat the people around you. And another thing is wash your hands. Wash your hands regularly before using the washroom, after washing the washroom, before eating, like washing hands. We also need to cook our meals very well. And to wash our vegetables and fruits before we eat them, to clean our surfaces, such things.
Well, we are talking about the causes. You also mentioned that chemo and radiotherapy could contain drugs that could maybe lead one to suffering from gastritis. About that, what do we do about that?
For chemo, because you have to continue with the medication. You cannot cease the chemotherapy because of the gastritis, which will go after the chemo. The gastritis, mostly the gastritis that happens with chemo, it goes away after the treatment plan regimen. So you will find like you will give the patient the medication to suppress the symptoms. Yes.
Thank you so much for that. So for a case of chronic gastritis, what length of treatment periods are we talking?
For example, if the root cause is H. pylori, because it's the major factor that causes the gastritis and the ulcers, you give a regimen treatment for 1 to 2 weeks of I know you have heard of H. pylori kits. If you turn positive for H. pylori, you're given a kit which you take to 1 to 2 weeks, 1 to 2 weeks, which includes 2 antibiotics and a protein inhibitor, which is esomeprazole. Like in we know in the layman's language, esomeprazole. And after you finish the 2 weeks regimen, now you continue with a protein pump inhibitor to a length of a month. So now you can go back to the hospital and get tested for it. Yes, and you test for the stool where you get to see whether the bacteria is present or it has ceased. Yeah.
We also talked about that there are some conditions that you could be suffering from, and maybe they can resort to gastritis. Maybe if you could just mention to us what are some of the common conditions that maybe you're suffering from these, and later on maybe it could lead to gastritis. What are some of the common conditions or illnesses that are associated with gastritis?
I will say for conditions that leads to gastritis.
In a case of autoimmunity, you mentioned that someone would have another underlying condition, and then now maybe it prompts gastritis.
There's a condition called the Hashimoto's condition. Is an autoimmune. People who suffer from diabetes, diabetes type 1, they have a higher risk of getting the gastritis. Yeah.
Thank you so much for that. And food poisoning, because that is something that that we've not talked about, we've not mentioned, but yeah, it does cause gastritis.
Yes, it's consumption of the chemical. If you consume a chemical and if you consume a chemical, the response of the body is to fight back, because it's a foreign body that has come to the body. So that causes inflammation of the lining, and that is what we call gastritis. So a foreign body, anything foreign body, because the inflammation of the mucosal lining that causes the ulcer, severe cases. Yeah.
Thank you so much. So I think that's about it. Unless maybe there is something else you want to hammer on or insist, so that people do not suffer from gastritis, which we've said it is very preventable.
I would love to tell my patients, everyone who is listening to me at home, like, we avoid the over-the-counter drugs. If you get the symptoms or signs like vomiting, fullness, just go to the hospital, get tested, and get the right medication. Yes.
Thank you so much for that. You know, every other doctor that I have hosted here said people should stop treating themselves.
Yes.
People should stop going
stop using Google. Yes.
Google is not your doctor.
Google is not your doctor, because ask Google, you'll use Google, and then Google will give you a certain condition, which is not whatever you're suffering from. That is why it is advisable for you to go physically to the doctor, and the doctor will be able to give you guidance on what to do, the natural remedies or the medication. Yes.
And actually diagnose you and prove that you really have this condition. That's why every time we are talking here in Medicamp, we make sure to include the diagnosis part.
Yes.
To know that by the time you're saying you have gastritis and you've not undergone endoscopy or any other of the processes that Dr. Ria said you're doing yourself disservice.
Yes.
Yeah, thank you so much.
Thank
to have
you.
been an honor to have you here at Medicamp. That's why we're going to be wrapping it up. See you in our next episode.
Okay, thank you.
Yeah, and always remember that your health is your wealth. So you should fight for it and make sure that you are healthy. Whatever you can prevent, let us all prevent it. My name is Mombe Maputi.
Thukuru wa The Nyeri National